Hello, I'm Dr. Maria from Pasadena, California, practicing integrative anti-aging medicine. As a preventive disease practitioner, today's topic, which is early detection of the diseases, is very appropriate to share. Technology has developed and in innovative testings. This has helped us, professionals and all patients, tremendously. So, in my book, I listed some common symptoms presented in my office that leads to some testing, and those are dizziness, migraine, hot flashes, fatigue, low energy, slow bowel movement, fungal infections and other infections, long-term therapy of any prescription drugs, long-term therapy or long-term use of any prescription drugs. People are concerned about the diagnosis usually of the first three causes of death in the world, not only in the United States. Number one is heart attack. Number two, stroke. Number three, cancer. Top three cause of death in US currently. The top two causes of significant lifestyle changes are Alzheimer's and Parkinson. People are afraid to hear those. Let me share with you Dr. Joe Kimball, postdoctoral fellow in biochemistry from University of Arizona. He's a PhD of physics from Texas Christian University. Dr. Kimball spoke in TEDx, told us about how he lost his two sisters and his mother from cancer due to late diagnosis. But he can now early test for himself. He explained about early detection of cancer using fluorescence. It has helped to detect others or many early stage of diseases, including, of course, cancer. You can search from the Mayo Clinic about other innovative early detections testing in specific conditions. For example, pregnancy test, COVID-19, using PCR swab and antibody testing in the blood, or Alzheimer's using 3D MRI, or dementia. And we know among the millennial, 1 out of 2 person will have dementia due to their poor lifestyle. I will tell you how I do an early detection in my practice though. New patient in my office will undergo 1. Biomarkers questionnaires, mostly from epigenetic and family history of possible genetic conditions. Number 2, we review together the past history, current, and family history of those 5 previous diseases mentioned. Again, it's heart disease, stroke, cancer, Alzheimer's, and Parkinson's. For early detection of those diseases, we start with heart disease, okay? When we talk about heart attack, it has been for the last 15 years at least that we can perform early detections. Many innovative labs offers testing or of biomarkers, testing or biomarkers we call it in the medical terms. The doctors can then use them to change the patient's lifestyle or what we call epigenetics, and then change the diet, change the nutrition before it becomes an unstable disease. Many patients are just receiving drugs to settle these abnormal test results or biomarkers that makes 80% of these conditions seems to be too late for improvement. Why? Um, Most of the cause are lifestyle adjustment rather than genetic. Genetic is only very little percentage, less than 25%, and out of the 25%, another 25% are difficult, but the 75% you can still prevent it. So we need to change it early enough, right? Okay. So patients usually do not have symptoms. This is why it's very difficult. Once they give me a family history, just family history alone, I will always run the heart attack biomarkers or testings in my lab requisitions. From the result of my requested blood test, then I will be able to see about the situations of the endothelial system. What is endothelial? Endothelial is the fine lining that link to the small microcirculations of the blood vessels that attach to the artery walls. Through this endothelial system or networks, we absorb nutrition and medication as well. I also test the endothelial function by measuring how fast your blood flow is. This is a very innovative measurement as the patients can easily relate to the improvement when I repeat to a follow-up in maybe 2 to 3 months later. My patients like to see objective findings when I endorse some lifestyle changes or additional nutrition to their diet or intermittent diet, or it's called intermittent fasting. Whatever the change must show some result for them to comply, right? The result of these two tests are additional to the blood test that they are used to taking. These tests are covered by their health insurance for any endothelial dysfunctions which is influenced by the patient's lifestyle but not necessarily treated with prescription drugs. I usually advise them to improve their lifestyle or prescribe nutritional medications, or what we call medical food. Results will be objectively seen in the follow-up tests within 3 months. If this is not detected early enough, endothelial lining will continue to decline, and when it is damaged, it will attract further automatic life-saving reaction, which is called plaque, the plaque in the artery system. This is a very early stage where we can then treat this inflammation before the unstable lesion, or what we call soft plaque rupture, and cause stroke or grow and block the artery and cause a heart attack. The stage can happen even at the age of 20, 30, because of their poor lifestyle. The younger they are, I think they don't think. They just drink, they smoke, they eat anything they like, sugar and things like that. When there is a significant plaque built up and undetected early, they will develop high blood pressure or headache. They go to the doctor. To save their life, the doctor immediately, the conventional way is to prescribe the drugs for high blood pressure or for cholesterol or fat. And those drugs have side effects. We know because it is approved by FDA. When anything approved by FDA and prescribed by physician, usually they have side effects, negative side effects. Most patients, when they come to my office after 40 or 50 years old and they're not taking any prescription medications, have a reasonably good lifestyle. They exercise, they eat well-balanced diet, and also they have a few supplements or vitamins. Chiropractors, physician assistant, nurse practitioners refer patients to my office for early detection testing in order for them to be covered by their insurance. The health insurance still depend on medical doctors. I hope in the future will change. Tests are performed, reinforced when lack of nutrition and early diagnosis are found. That's the most important things. In my office, we have several tests for leaky gut or imbalanced microbiome or bacteria, and that can lead to heart disease. Now we talk about the second major cause of death, which is stroke. We look into further details, such as specific lipids or fat, to determine any inflammations that might already invite the formation of soft or hard plaque, which can cause high blood pressure, and eventually, when the soft plaque breaks, it will cause a stroke. The third major cause of death is cancer. Cancer is the most devastating diagnosis when the patient is labeled with the cancer diagnosis. Cancer is actually an old age cells. It should happen to just in age or older patient or people due to the weather, the food, the air qualities, stress that they endure, traffics, financial stress, especially now during the pandemic, the cell gets older faster. What do we do for early detection of cancer? Cancer also does not happen with any symptoms or develop in a day. Since the cause can be multiple, and this is confirmed evidence-based reports, I will name a few. Number one, free radicals. Two, poor nutrition, low vitamins, such as simple as vitamin D causing low immune system. Imbalanced minerals such as iodine for thyroid nodules. Severe stress induced resulting of weak immune system. 5, toxicity like heavy metals, hydrocarbons, carbon inhalations, overload radiation. 6, overload anaerobic bacteria, virus, fungus, parasites, protozoa, which can initially give us cyst, polyps, tumor, or diverticulitis, then slowly change to cancer. Last one is imbalanced hormone. Some metabolites of hormone can induce tumor or cyst that can also change to a cancer. What can we do to prevent those new abnormal reactions before it becomes cancer? Or is cancer detectable? Cancer is usually diagnosed through a cell biopsy, where they see the cancer cells under the microscope, or through now an MRI, sensitive MRI, 3D, okay, where the growth is no longer represent a tumor, which is fine growth and round, but it looks like cancer, and it's typical. With recent lab and technology, we can now do what is called blood biopsy. We can detect by not doing tissue biopsy, but just drawing patient's blood. This test has developed rapidly, and most of the innovative lab can accept this test request. However, the early detection is through what we call tumor marker in the patient's blood. According to American Cancer Society, 1.6 million new cancer cases will be diagnosed in US annually. Over 600,000 deaths will occur here in US each year. What a tumor markers is? Tumor marker is the test is called tumor markers. So it is a substance found in higher than normal level in the blood, urine, or tissue of people with cancer or abnormal growth. But these can also be made by healthy cells and tumor, cysts, or polyps. There is no evidence that tumor markers is 100% reliable to determine presence of or absence of cancer. There are some patients with already a history of cancer. They were treated, perhaps they had surgeries, and during their follow-up, it's still receiving PET scan or CT scan or MRI test. MRI is a better one because it's not radiation. Okay, rather than just a tumor markers, they follow up with those testing. Some innovative labs offer testing such as CTC testing, which is circulating tumor cells. This is from the blood. So they don't have to go through radiations. This is a very helpful test for people who cannot tolerate treatments such as radiation therapy or chemotherapy, but they use alternative therapy or complementary therapy using biological unchelating agents. Some people cannot tolerate the chemical one. They just have to use the biological one. Tumor markers are usually covered by health insurance, although lately it has been difficult to even get a test such as prostate specific antigen or AFP, antigen of fetal protein. That's for the liver. It's very difficult because they want you to have cancer first before they want to do that test. The available tumor markers are for any detections from the neck and body. So from here down, the tumor markers can do that. But it is still difficult case for early detection of HEENT. So head, ear, eyes, throat. Head, ear, and eyes and throat, HEENT. Usually, do a good examination and symptoms, we initiate CT scan or MRI, even consultations to a specialist according to what they have, to ophthalmologists, to ENT doctors, and they can figure out what test is appropriate for head and neck cancer or tumor. Now we comes to the real two diagnoses that very often and often that people are scared of, which is Alzheimer's. This is also called apparently diabetic type 3. Many of you heard about diabetic type 2. Now this is type 3. They have findings in the blood tests such as insulin resistant. They have high insulin, but it's not working. It's called resistant. Fatty liver, memory impairment. There is a question and answers for this. It's called brain testing for Alzheimer's. And then markers in the blood and gene testings. For Parkinson's, I'm considering doing Alzheimer's in a future video. But for Parkinson's, I usually send my patients for the special testing at Cedars-Sinai Medical Center. They have a very good protocol there. The National Institute of Health, NIH, has developed an accurate test for early detections of this Parkinson's. We test the Lewy body from cerebral fluids, spinal fluids. We take the sample and 93% is accurate. Alzheimer's patients and dementia patients can be diagnosed as well. This diagnosis is published as a report in the Journal of ACTA Neuropathological Communications. Previously, we can only analyze the brain tissue after the patient has passed away. Not anymore. Unfortunately, the early diagnosis can be difficult as symptoms are so overlap, and also findings between all neurodegenerative conditions. Early diagnosis is difficult, but any targeted therapies can be initiated is good before further tissue damage is done. We do not want to wait until symptoms appears. This helps scientists also develop treatments to conditions such as Alzheimer's, Parkinson's, or cancer, heart disease, patients who are eligible for clinical trial, especially in integrative medicine, where we use many epigenetic or lifestyle changes, diet, nutrition, detoxification in the very early stage. Detection of many other conditions are vastly available now. Knowing that this can save many people's lives, I always tell my patients to give themselves a gift of optimal health on their birthday or birth month, at least an annual checkup. So they can remember, because everyone knows their birthday or birth month at least, right? So I do it too. So on my birthday or birth month, I visit my OBGYN and I do my annual. I have now completed 7 pillars from my book. This book, No Code Medicine. Okay, so one moment. Okay, people ask me about how to suggest comments like titles. You can just when this is posted, there is a box for comment. Whatever you want to know about health, you can write there, and then that will give me an idea of what the kind of topic I should select for 30 minutes. Now, we have exciting 2021 integrative medicine topics, and I will invite you to pick this year. Doesn't have to wait for 2021. So thank you for listening. This is Dr. Maria, integrative anti-aging medicine from Pasadena, California. Please like this video and subscribe and share my channel to friends and family. See you next week, the same time.